Good afternoon. Thank you to Casey Security for sponsoring this 1 p.m. edition of First Local. We are waiting for Premier Doug Ford to grace us with his presence today and address the province shortly. He will be joined with Christine Elliott, who is the Deputy Premier and Minister of Health, Solicitor General Sylvia Jones, and Dr. Barbara Yaffe, Associate Chief Medical Officer of Health, to make an announcement. But before we throw it over to Queen's Park when we see the Premier on the screen, let's check in with Weather Daniel to find out a little bit more about this white stuff.
Hi, Weather Daniel here with your on-TV Weather Minute for your Monday, November the 23rd. We're looking at a snowy morning and afternoon on your Monday. That's going to continue until things settle down and cool off for the overnight. Now let's look outside at the camera, and it is brought to you by wirelesscom.ca. Not much to report in the sense of sun today, other than it's peeking out a couple of times. We will see things get down to a low of -11 tonight with a wind chill of -16. Sun will be out Tuesday with a few clouds. -2 is your high before sleet returns on Wednesday, and then we got overcast for a couple of days before the sun is out on Saturday and Sunday with a high of 7. Snow is back on Monday with a high of 0. Overnight lows will hover around the freezing mark and hit -4 degrees on Monday night. Have a great day, everybody. This has been your On TV Weather Minute.
Thanks, Dan. Again, the Premier will be making an announcement shortly alongside Christine Elliott, Sylvia Jones, and Dr. Barbara Yaffe. We are just waiting to see the Premier walk out in front of those flags, and once we do, we'll throw it over to him. But before we do that, let's go with some local news. On November the 21st, police services arrested a 50-year-old lady, Diane Dugay, for impaired driving due to alcohol and drugs. At around 2:30 in the afternoon, officers received a report of a woman sleeping in the driver's seat of a running vehicle in the 1200 block of Wellington Street East. Upon arriving, officers observed the accused and developed grounds to believe her ability to operate a motor vehicle was impaired by drugs. She was arrested and charged with impaired driving, alcohol and drugs, and is scheduled to appear in court on December the 28th. Again, on November the 21st, officers with patrol services arrested 28-year-old Adrian Marcel for refusing to comply with a demand. At around 10:30 in the evening, police were notified of a vehicle stuck in a ditch in the 1200 block of People's Road. Upon arrival, the accused standing outside the vehicle. Upon speaking with the accused, officers developed grounds to believe his ability to operate a motor vehicle was impaired by alcohol. He was arrested and later refused to provide a breath sample into an approved device. He is charged with refusing to comply with a demand and scheduled to appear in court on December the 28th. It's a very sad day for Sault Ste. Marie as 84-year-old James McCauley died Saturday at Sault Area Hospital. McCauley was one of the figures who brought the Sault Greyhound hockey team to the Ontario Hockey League in 1972 and acted as the team's president for almost 20 years. A well-known community figure, volunteer, and philanthropist, McCauley also helped run his family's oil business and was involved in property development within the community. In 2002, McCauley was presented with the Queen's Golden Jubilee Medal for his commitment to the Sault through his entrepreneurial endeavors and community involvement in local initiatives. He also received the Sault Ste. Marie Chamber of Commerce President's Award in 2007. Jim will be greatly missed throughout the city as well as at the GFL, where he faithfully would sit and cheer on the Greyhounds at Centre Heights 4 rows up. McCauley was a widowed father of three children and grandfather to 5. It's that time of year. Let's help local families build strength, stability, and self-reliance through affordable home ownership and a chance to win $5,000 gift card for Sault Mill Build-All. The draw is November 30th. Tickets are $10 each or 2 for $15. We are going to throw to a commercial shortly as we're still waiting to see if the Premier will arrive to the podium. We will have more local news when we get back after this commercial break.
It's been a while since I've seen Joe. We were a couple of pranksters, and Joe was always full of surprises. But today, he's the one in for a surprise.
The thing is, Joe doesn't live here anymore. For people living with dementia, getting lost can happen unexpectedly. Are you ready to help? Help people living with dementia live safely in our communities. Contact your local Alzheimer's Society and visit findingyourwayontario.ca.
Welcome back. We will now throw to Queen's Park to hear the Premier speak.
For all of us. And I know in these toughest days, with the numbers on the rise, with our hospitals filling up, with restrictions in effect, I know that right now it's hard to imagine life after COVID. It's hard to imagine the end of this pandemic. But my friends, we can't give up hope, and we won't give up hope. This pandemic, it will come to an end. Over the past several months, the brightest minds around the world have been hard at work. Scientists, doctors, and researchers have come together in search of a vaccine to protect all of us. We're starting to see early signs of success. Once approved, once in mass production, these vaccines will finally bring an end to this pandemic. The vaccine is what will get life back to normal. These vaccines, they will be absolutely critical, and we are working hard with the federal government to get absolute certainty about the path forward on Health Canada approvals and on timelines on when Ontario will receive our shipments. And in the meantime, it's up to us to do what it takes to protect our hospitals, our schools, and our long-term care homes. And it's up to us to get ready for when the vaccine is available. Because I won't sugarcoat it, rolling it out, distributing this vaccine, it will be a massive logistical challenge. In fact, without the right planning, it risks being a logistical nightmare. And that's why we've been working for months on the infrastructure, on the processes, on the tools required to deliver this vaccine as smoothly as possible. It won't be easy, so we need to do everything in our power to be ready. We're being told that by early 2021, the first doses will be available. And when those doses are ready, we have to be ready as well. That's why I've struck a task force. We're bringing together the best and brightest minds, experts from across the board. This is going to be the largest logistical undertaking in a generation, and we need an expert in logistics. We need a general in charge of this massive undertaking. That's why I've asked General Rick Hillier to chair this new task force, and he has accepted because we need military precision. We need the discipline that only a general can bring to this task. General Hillier is a Canadian hero. He previously served as the Chief of Defence Staff for the Canadian Armed Forces. He was a commander of the NATO-led forces during the war in Afghanistan. He also led 15,000 members of the Canadian Armed Forces to help Ontarians and Canadians after the 1998 ice storm. And now he will bring that same leadership and that military precision to this new task. On behalf of all Ontarians, I want to thank General Hillier for his service and for agreeing to take on this challenge. The task force will leave no stone unturned. We will pull out every single stop we have to get ready to get this vaccine distributed. And as Premier, you have my word. We will get vaccines to every part of this province when they are ready. We will get them to our seniors, to our frontline workers, to every person who needs one in this province. All of our collective efforts, all of our collective sacrifices will get us there. Thank you, and God bless the people of Ontario. Now I'll pass it to Minister Elliott.
Thank you, Premier, and good afternoon. We are on the verge of a critical new phase in our efforts to stop the spread of COVID-19 with the recent news about the Pfizer, Moderna, and now the AstraZeneca vaccines. Our government has been working very hard to date to support vaccine planning and deployment, and I am thrilled that General Hillier will be joining us in this next phase. General Hillier's track record of leadership and compassion make him the right person to lead our minister's COVID-19 vaccine distribution task force. This task force will be made up of representatives from across our government and will include experts in operations and logistics, federal-provincial relations, healthcare, public health and immunization, ethics, information technology, and data. Mario Di Tommaso, Commissioner of Emergency Management, and Helen Angus, Deputy Minister of Health, will serve as vice chairs of the task force. Together with General Hillier, they will be responsible for the day-to-day assignments and ensuring the task force fulfills its mandate. Other members of the COVID-19 vaccine distribution task force will be announced in the coming days. Their job will be to provide us with advice and recommendations focused on the timely and efficient rollout of Ontario's COVID-19 immunization program as vaccines in development become available, and ensuring the province can immunize people as quickly and efficiently and safely as possible. They will be advising on the delivery, storage, and distribution of the vaccine, support healthcare system partners to deliver a phased vaccination program that will initially prioritize vulnerable populations, followed by mass immunization, clinical guidance on vaccine administration and surveillance of vaccine uptake, data, reporting, and technology to provide timely, relevant, and accurate information to clinicians, decision makers, and the public, and the implementation of broad and sustained public education and community outreach efforts to encourage vaccination. This campaign will be unparalleled. The response will require coordination and touch all parts of the health system and beyond, and the participation of health providers across the province. Minister Jones and I, along with our ministry officials, are looking forward to engaging with General Hillier this week as we refine our plans based on his advice. I want to emphasize that planning for the early rollout of the COVID-19 vaccine program with vaccines from both Pfizer and Moderna is well underway. We have been working with local public health units and other provincial partners about priority populations and the rollout of the vaccine for these groups. While there is light at the end of the tunnel, it's important to keep in mind that a vaccine is still months away. So I'm urging everyone to please continue following public health advice in order to limit the spread of COVID-19 and keep our communities safe. We are all in this together. And working together, we can protect our family and friends, our neighbors and loved ones, so that we can stop the spread of COVID-19. Thank you.
We'll go to the phones for questions. First question, please.
First question comes from Lucas Meyer at News Talk 1010. Please go ahead.
Hi, Lucas.
Very much. For Dr. I think this is for Dr. Yaffe. Sure. So last week, when the new measures were put in, there was a discussion around, reviewing the data every week. So what are the, maybe the 2 or 3 things specifically that you'd have to see to change that? I know to get into red, cases have to be 40 by 100,000, for example. So is it that and a few other things to potentially alter that 28-day schedule?
Well, the 28-day schedule for the so-called lockdown is fixed. I don't believe, unless there's a drastic change in Toronto and Peel, I don't believe those will be changed until after that. But we certainly are looking at the data every day, and we look at the number of cases per 100,000, and as you said, 40 is the threshold for going into a red zone. But we also look at the percentage positivity for lab results. And we look at what's happening with the public health system capacity to do case and contact follow-up. Are they getting overwhelmed? And again, as well, the health system capacity. Are the hospitals getting overwhelmed? Are they able to accommodate patients with COVID-19 both in the hospital generally and in the ICU without impacting what's so-called elective admissions for surgery or cardiac procedures, etc. So we look at the trend as well. It's not like the minute it hits 41 per 100,000, we know it goes over. We consult the local medical officer of health, and who usually knows the best of what's going on in the community, and the local elected officials to determine what are the best measures to take to control and prevent the transmission of the infection in the community. So it's not black and white. There are a bunch of criteria we look at and we consult, and then the decision is made.
Follow up?
Thank you, Doctor. And for Premier Ford, on the business side, we just heard from the Hudson's Bay here on Queen Street, and they're actually completely open. They're mentioned that they are considered essential. I understand that grocery stores and keeping supply chains going is obviously very important, but I think some business owners would be surprised to hear that a store like the Bay can stay open, but smaller ones can't. So why is a store like that considered essential?
Well, I can pass it over to the Dr. Yaffe, but I just really want to tell all businesses, small businesses especially, we're there to support you. We have to get through this. And what's going to be the game changer is this vaccine. And once we get this vaccine, we can get back to normal. Thank you.
Well, first I want to start by saying, regardless of what's open or not, the advice we have for everybody, particularly in Toronto and Peel, but really across the province, is don't go out if you don't need to, and minimize your encounters with other people, because that's how this infection spreads. If a large store is open, it would be because they are serving either one of the essential services, be it groceries, pharmacy products, hardware, and so on. And if the whole store is open, I believe that was a decision made by the decision makers in the province that not to cordon off certain areas, which is something that has been done in Manitoba, to my understanding. But again, the bottom line is, don't go if you don't need to.
Next question.
Next question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Mike.
Hi. Premier, if I could follow up on that question.
Sure.
From a policy standpoint, as Dr. Yaffe mentioned, in Manitoba, retailers who are allowed to open had to cordon off non-essential items from their stores so that they wouldn't be open to selling people things that were not essential just because they happen to have some groceries. And this is the particular criticism that's coming from the small business community is, big stores like the Walmarts and the Costco's get to open because they sell groceries, but then they're able to then sell all the other things that they have in their stores, which could be deemed non-essential. So why didn't Ontario make a policy decision to sort of level the playing field here a bit for small businesses and allow them to stay open in some sort of other way that helps them compete against the big box stores?
Sure, and a good question, Mike. You're 100%. It's not fair. After speaking to some of the big box stores, it'd be a logistical nightmare. They have essential items spread out throughout their whole store. And then on top of that, how do they monitor it and restrict people from going in there? That's the feedback I got off them, and all of a sudden someone goes and grabs a pair of jeans, throws it in their shopping cart, and they have 100 people behind them and shopping, and they have a list of items. It should be a logistical nightmare. And as for Manitoba, after speaking to the CEO of Walmart Canada, it's creating massive problems out there. So again, I know this is not fair. And that's why we put an additional $300 million in to support small businesses and the 90% rent, 65% of their wages, and took care of their property taxes, their energy costs. We're doing everything we can as a province. But the quicker we can get through this, the quicker we can get this vaccine out there, then we can get people back and open up.
Follow up.
Premier, your government's proposing to extend Dr. Williams' term as Chief Medical Officer of Health.
Yes.
Why do you feel that he's the right person for the job?
Well, he's brought us all the way through this, along with Dr. Yaffe and their whole team. So I want to again thank all of them. And I just do not ever believe in changing a dance partner in the middle of a dance, especially when he's an incredible dancer like Dr. Williams. He's a great doctor. And I give Dr. Williams, Dr. Yaffe, and I could list off all the doctors, I'm not going to. I give them all the credit in giving us guidance. And if you look at it, and Mike, please, this is nothing to brag about because we're in a serious situation. But when I compare this spread that's going across our country and to the exclusion of the small maritime provinces, we have the lowest cases. Then I look at the United States. Again, outside of a few small states, we have lower cases per 100,000 than any other jurisdiction. Again, I repeat, this is nothing to be bragging about because we're in a serious situation and we're doing everything we can to lower the cases and get this vaccine once it lands out the door until we can get back to normal here.
Next question.
Next question comes from Randy Rath at Sage TV. Please go ahead.
Hi, Randy.
Hi, Premier. I'm wondering if we could get any more information about the rollout of the vaccine. It seems that this is going, mass vaccination is going to take a long time to happen. Realistically, what are we looking at? Several months? Are we looking at next summer? When do you predict we could get back to anything that's near normal in this province?
I'll pass it to the minister in a moment here. But again, the toughest thing, the easy part of this, and we're very grateful, by the way, is to cut a check and order the vaccines. I'll be very frank. The toughest thing for all provinces is logistics and distribution. And we have experts right across the board, from the health side, science, to experts in distribution. And I said right from the beginning of this, we need military precision. I want to thank again General Hillier, number one, for taking my call and accepting this challenge. But there's no one better in the country than General Hillier to make sure this distribution happens. It's going to be a massive challenge. I have 100% confidence in our team as a whole, and it involves everyone. I always say our team is the 14.5 million people of Ontario. I did send a message to the Deputy Prime Minister this morning. She said she'll get back to us on a date, and once we get that date, we start working backwards. I'll pass it over to the Minister.
Well, as the Premier indicated, first we do have to know when we are going to be receiving the vaccines and how many precisely. We have a pretty good idea based on per capita distribution, but we need to finalize that. And then we have the immunizations that are going to be happening from when we receive them to March. Then that's within the first tranche of the Pfizer, Moderna. Then there will be a second tranche from March till about July, which will include those two, as well as perhaps the AstraZeneca vaccines that are mostly ready to go. And then we have a logistical challenge in making sure first we have to identify who will receive the first tranches. I would expect it would be our most vulnerable people in long-term care homes, as well as our frontline healthcare staff. And we have to vaccinate them not once, but twice within 21 days. So there's going to be a need to have very, very detailed, very precise clinical records. That's why we have people with the various degrees of knowledge and experience, including IT and data people there, to make sure that we do this properly. But we have we're assembling all of the necessary voices at the table to make sure that this goes seamlessly.
Follow-up?
So it will take until next summer for this to happen, is what I believe I just heard. And on another subject, there are companies that are offering private COVID tests. And I'd like to ask, is this a way that people could have Christmas gatherings if they got their family tested and then they isolated, then they all got together for Christmas? Is that something that would work to keep people safe at Christmas?
It would help, but I'll pass this over back to the Minister. Thanks, Randy.
Well, we really are recommending that if people don't need to go out, as Dr. Yaffe said, please don't go out, don't get together in large family gatherings. Stay within your own household. That's really the best way for us to flatten this curve, and that's what we want to do, is to stop this community transition and transmission. So we need to follow those public health guidelines. Please follow the new rules that are effective in lockdown and in all of the other categories that whatever public health unit region finds themselves to be in. But we have to follow all of these rules and make sure that we continue to follow them throughout this lockdown period.
Next question.
Next question comes from Laura Stone at the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. I want to go back to the small business issue. Look, I understand you're saying that there's funding coming and that a vaccine will solve this, but these are small businesses now during the busiest season who are forced to close for in-person shopping in Toronto and Peel, and they're saying that they're accusing you of destroying their business. So they're now asking for you to reverse this somewhat, to allow appointment shopping or even limit customers. Is this something that you are at all considering? And if not, why not?
Well, you know, I'm always going to listen to the health experts on this, take the advice of the Chief Medical Officer and their team. And if we don't do this, we could be in the same spot as we've seen a few provinces that per capita, last I looked, there are 6,000 cases a day in a couple provinces, one in particular, and it's out of control. And then if, we just want to continue and just keep dragging this out, we're putting hospital capacity at massive risk, spread of our schools, spread of our long-term care. That's the risk. I'll pass it to Dr. Yaffe. Thank you.
Basically, it's very, very unfortunate that we are having a negative impact on lots of things by our public health measures. That's why these are taken with great deliberation and thought and consultation. They're not done lightly. But at this point, the numbers, the rates, the cases are going up very high, particularly in Peel, also in Toronto. And we are finding the hospitals are getting overwhelmed. We are having more deaths. And we know that this can be prevented. So you may recall the modelers, I guess about a week or two ago, predicted that if we don't do more measures, we could end up with 6,500 cases a day in Ontario. We don't want to go there. And then the bottom line is, what is the most important thing? It's health. So we need to help the businesses, as the Premier said. We need to work with everybody as best we can, provide support, but we cannot let the numbers just keep going up without doing what needs to be done. There are more aggressive measures that are being done in some other countries. We have not gone there, like curfews, like having police at borders between units. So we are again trying to take a very balanced approach that will be the most effective without affecting civil rights. And it is difficult. It's a very difficult situation, and we're doing everything we can with that balance in mind.
Follow up?
And Premier, on the decision to extend Dr. Williams' appointment, he has faced a lot of criticism in medical circles for his response to the pandemic, but particularly his communication. So for those who have criticized his performance and have called on you to replace him, what do you say to them, and why are you standing by your decision to extend him today?
Well, first of all, I want to say that I have the utmost respect for all medical professionals. They can agree or disagree, because every one of them has contributed to our safety day in and day out. So that's the first thing. Second thing is, I learned many years ago, don't criticize until you've walked a mile in someone's shoes. And it's easy to criticize when you aren't deep into it. And the endless decisions that Dr. Williams and his team has to make every single day, and results, they say everything. I always say I measure everything. And again, this is nothing to brag about, but we're still the lowest cases in North America for any region our size. So I have all the confidence in Dr. Williams. He's doing a great job, and I'll always be there shoulder to shoulder with him until we get through this. And I appreciate the easy thing for Dr. Williams to do. This is the easy thing for him to wash his hands and say, I don't need this anymore. He's not built that way, He's a man of integrity, a man of honesty, and he's passionate about helping the people of Ontario. I can assure you, Dr. Williams doesn't need that, few extra dollars and going through this for the next 7 months. I'm sure he'd rather be up at the cottage somewhere. But this is what this man is made of. And I think he's incredible, and good for Dr. Williams. I'll always stand shoulder to shoulder with him, along with Dr. Yaffe and the rest of the medical team, because they brought us this far, and we're going to get through this as sure as I'm standing here.
Last question.
Last question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Rob?
Hi, Premier. I just want to go back at the small business stuff. One of the things that the CSIB is asking, and you may want to flip this to Dr. Yaffe as well, but what is the data? I was looking at data to support closing all these small businesses? I know the CFIB has proposed a strict limits like maybe 3 customers in a small retailer at once. Why won't you consider that? I looked at some of the data in the weekly summary last week, and it doesn't point to I don't think so, and correct me if I'm wrong, crazy levels of spread in small businesses.
Mm-hmm. You know, Rob, how can I say this respectfully? I believe me, you guys have done a great job, the media. Rob, you're a champion. You're doing a great job, and it's not you, but last week or 2 weeks ago, you know, the media is hammering you about closing it down, and they're pulling out every doctor from every place they could find. This week, now they're pulling out every single small business owner, and it's not your fault, Rob, or anyone's fault. It's just that it's tough. It's tough to balance the health and the well-being of society, because that's the number one priority, in the economy. It's a challenge. But I'll tell you one thing, if we just ignore the health and just say, okay, let's open everything up, as sure as I'm saying here, we would be in a terrible, terrible shape, massive crisis on our hands. But I'll hand it over to Dr. Yaffe.
Our data on where cases acquire their infection or where it's transmitted is somewhat limited by the fact that some of the health units are so overwhelmed, despite all the support they're being given, that we aren't able to identify in about at least a third of cases where they acquired it. So that's evidence of widespread community transmission. So it's happening wherever people get together. The data on outbreaks really only reflects about 10% of cases. So there may not be that many outbreaks with a particular store or a particular restaurant, although there are outbreaks associated with places like that. The majority of outbreaks that we know about are, of course, in long-term care facilities, retirement homes, schools, and so on, because those are the ones that the health units prioritize for follow-up. When they investigate, when they call a case, if that case says they visited a retirement home or prioritized. The fact that somebody went to a store or a restaurant may or may not be identified as a source of infection. So I think the data is somewhat limited in that way, but we know that people get infected when they are in places with other people, especially if they're within 2 meters and if they're not wearing a mask, and especially in smaller rooms, smaller spaces where they're more crowded, where perhaps the ventilation isn't as good as it could be. And those are the kinds of circumstances that may occur in smaller businesses. I'm not saying they do in every business, but those are the kinds of circumstances that help the transmission of this infection. So we can't just look at the data that we have to look at the whole picture.
Follow up?
Okay, thanks for that, Doctor. That's the kind of explanation I was looking for in terms of the general circumstances. But what I'm wondering is this whole thing that Mike brought up, Mike Crawley, about the Bay being open downtown. I know the Premier's already said it's unfair. It does seem unfair. Yeah. So can you get into a little bit more detail on how that happened?
I'd have to look into it and find out what they're actually selling. Are they selling hardware within the Bay? Are they selling any other critical items, food? So that's what I'd have to look into. And again, you know, Rob, it's terrible about it. Nothing's fair about this COVID, but I'm doing everything we can to protect and support the small businesses out there. And that's why I said the other day, you know, order off small businesses when you can. Maybe not the big companies that are out there, and you know, you get it from all ends. I mentioned a company the other day, you got a nasty letter from them. Well, I can tell you they're going to do all right. It's the small businesses, so continue supporting small businesses, order off them opposed to the big folks online, because the big guys are going to survive, and we just have to protect the little guys right now.
Thanks, everyone.
Thank you, everyone. Thank you.